Hi everyone, and welcome back to TS Fibro. Whenever you see my videos, you'll see on there that it says my research, my opinion. I've been doing research for fibromyalgia ever since I found out I had it, and that was in 2012 was when I was actually officially diagnosed. I've known I've had it for a lot longer than that, but anyway, with all of the research that I've done and my observations and my opinion is what I give on my channel. So I just wanted to make sure everyone knows that I'm not a doctor. I'm not an expert except for myself, fibromyalgia on me. But my opinion and some of the research I've done is that fibromyalgia is linked to the central nervous system. It just makes more sense to me. I mean, your nerves are what transfers the signal of pain. So it makes sense. So this is what I found. I found that researchers have figured out that fibromyalgia, which is the second most common rheumatic disorder, has origins in the central nervous system. Daniel Claw, a professor of anesthesiology at the University of Michigan, analyzed the neurological basis of fibromyalgia. The results of the study were presented at the American Pain Society annual scientific meeting. Fibromyalgia is still widely misunderstood, with it now being considered a lifelong central nervous system disorder that causes significant pain to the sufferer. Fibromyalgia is thought of both a discrete disease and a common pathway of pain centralization. A lot of people who suffer from fibromyalgia have pain throughout their entire bodies, which is hard to diagnose because of the lack of cause and outward signs of the disease, such as a specific injury. There are a few reasons why fibromyalgia can be hard for doctors to diagnose. Fibromyalgia often mimics other conditions. Doctors will often rule out other conditions first, such as rheumatoid arthritis, lupus, multiple sclerosis, Lyme disease, and mononucleosis. There is not a specific test or medical scan for fibromyalgia, although they are working on a brain scan where they have found differences in a fibromyalgia brain and a normal person, non-fibromyalgia patient. I'm not too sure any of us are normal anymore. And there's also a blood test that they are working on that they have found differences on fibromyalgia patients and non-fibromyalgia patients. So they haven't perfected it yet, but they are working on it. So one day, hopefully, they'll have a specific test, a blood test, brain scan that they can do and diagnose us with fibromyalgia or rule it out. Fibromyalgia pain flares can change also. They change day to day, week to week. One day you can be in a flare and the next day you can be okay. Fibromyalgia can vary person to person and day to day, of course. Symptoms can flare on one day, be better the next. Fibromyalgia symptoms can also be affected by your level of stress and physical activity, all factors which contribute to making fibromyalgia difficult to diagnose. So hang in there. The researchers found out that fibromyalgia pain typically comes from the brain and the spinal cord. Then the pain extends outward to the peripheral pain, and it is often associated with changes in pain perceptions in the brain. If someone has multifocal or musculoskeletal pain, then it is likely that the person is suffering from fibromyalgia. The patients who suffer from fibromyalgia often have pain occurring in different parts of the body because the pathways of the pain are intensified throughout the entire body. There is also sensory hyperresponsiveness of the pain is also seen in patients with fibromyalgia, and this means that patients feel pain more so than normal people who don't suffer from fibromyalgia. Since fibromyalgia has a central nervous system origin to it, this means that treatments with opioids and other narcotic medications are not usually successful since the medications do not stop the neurotransmitters in the brain. Painkillers like Vicodin and Percocet are not effective for fibromyalgia patients, and these types of medications can even make fibromyalgia and other central nervous system conditions worse. Claus said that clinicians need to start integrating pharmacological treatments that deal with the neurological aspects of the disease, such as tricyclics and SSRI types of medication. Cognitive behavioral therapy and exercise may also be beneficial for fibromyalgia patients, since therapies besides drugs can end up more successful in the long run. The main goal for doctors who are dealing with patients who suffer from fibromyalgia is to decrease the pain and improve function, and a lot of patients see improvements with non-drug therapies and neurological medications. There are typically side effects that are seen with medications like gabapentin and SSRI medications, since they are drugs that affect the brain, but these types of drugs do help lessen the neurotransmitters going to and from the brain. For patients who suffer with fibromyalgia, the biggest thing that patients need to do is find ways to decrease their neurotransmitters, since that is what is responsible for the pain and increasing the pain throughout the body. Also, patients want to particularly pay attention to yoga and meditation as a way to help treat fibromyalgia, since decreasing stress can also help decrease the number of neurotransmitters misfiring in the brain. More research will need to be done, however, because fibromyalgia is still a very misunderstood disease, with doctors often questioning whether or not fibromyalgia is real or just a way to get pain medication. For now, though, it seems that progress is being made in terms of finding ways to properly treat fibromyalgia, which can help patients get back to a normal and healthy quality of life. What might cause fibromyalgia? What are the possible causes of fibromyalgia? Researchers recognize that fibromyalgia is genetic and that experiencing stressful events often prompts its onset. Physical stress, like a car or sports accident, emotional stress, a traumatic life event, medical stress, certain infections, illness, or surgery. Sometimes other health conditions can bring about fibromyalgia, including lupus, rheumatoid arthritis, and autoimmune disease. Fibromyalgia sufferers have a lower tolerance for pain than those without fibromyalgia. Why is it so? It has something to do with the way their spinal cord and brain process pain. People living with fibromyalgia feel pain more intensely as the irregularity occurring in their central nervous system amplifies the pain. Even ordinary non-painful things could be very painful for those with fibromyalgia. For example, healthy people would find a massage to be comforting and enjoyable. Fibromyalgia patients may find a massage to be rather painful. The tender points of fibromyalgia. Tender points are multiple areas of the body where pain and tenderness can be felt immediately beneath the skin when pressed. They are around the joints, tendons, and muscles, and scattered over the back, chest, neck, elbows, hips, the butt, and knees. To be diagnosed with fibromyalgia, your pain should be chronic or present for more than 3 months. It is common for fibromyalgia sufferers to say they feel like they have the flu and they hurt all over. Some days the pain gets more intense, and many patients report having flare-ups for a couple days, a week, a month. Please remember, even though we have fibromyalgia in common, doesn't mean we experience it in the same way. What works for one person may not work for another. Since fibromyalgia comes with an array of other ailments, means the treatment we need will vary from one fibromyalgia patient to another. There is a lot of different information out there that comes to different conclusions, and I am just presenting the one, in my opinion, that makes more sense to me. I welcome any conclusion that you yourself have come to. I would love to hear your ideas in the comments below. Thank you, and I pray for a cure every day, and I pray that you have a pain-free day.